Hey everybody, thank you so much for taking the time to tune into my presentation. My name is Siyeon Lee and I'm a rising junior at Yongsan International School of Seoul. I'm recording this on the evening of June 19th of 2021. And today I'll be going through my presentation, which is titled Canceling Cancer Drugs, Socioeconomic Disparities in the Role of Cancer Treatment. So a little bit about myself. I was born and raised mostly in Seoul, but I also spent a significant portion of my childhood in Malaysia. I love theater and Model UN, so I would say those are my two main academic interests. And outside of that, I love gaming, cooking, and drawing. I'm very passionate about biology and health, so that's the path that I want to pursue in the future. And yeah. As for the general outline of my presentation, I'll be delving into these three main points: global health in relation to rising cancer costs, cancer capitalism and socioeconomic injustice, and anecdotes, summary, and proposed solutions. Health is and always has been a significant topic to our lives. Health expenditure, however, has been increasing disproportionately. Not only have drug benefits and medical insurance spendings increased for the average American, medical ethicist Leonard M. Fleck notes that at around 2004, around 16.3% of the US GDP was occupied with health spending, with more than 1.8 trillion USD being spent each year on health expenses. This is comparable to the 5.2% GDP occupied in 1960 and shows the notable changes to federal priorities. Even with this increased attention put into our health systems, cancer is yet to become a lesser topic. Since the curious pioneering discovery of radiotherapy, cancer therapies and treatments have become institutionalized and federally funded. According to a group of researchers in the International Journal of Cuban Health and Medicine, however, 12 out of the 13 cancer drugs approved in the United States in 2012 cost more than $120,000 per patient. This sort of increased expenditure is socially and politically problematic, in light especially of federal deficits. Cost friendliness is a significant issue in our current system of cancer care. It is imperative to discuss the social, ethical, and economic implications to the backbone of our current American healthcare. SES, or socioeconomic status, has a complex yet statistically significant effect on cancer detection, treatment, and advancement. In the 1999 research done by Adler and Ostrov in the New York Academy of Sciences, cancer survival rates were significantly higher in those of higher SES when those specific cancers were discoverable locally. This makes sense as individuals of lower SES who lack resources compared to their higher SES counterparts do not treat their symptoms early and advance into further stages. Comparably, some cancers were linked with individuals of higher SES. Skin melanomas and breast cancers were both linked with recreational tanning and delayed childbirth, and were observed more frequently among higher SES women. SES is determined by countless different factors. According to the National Longitudinal Mortality Study, men and women who lacked a high school education had a significantly higher chance of obtaining lung cancer compared to their college-educated counterparts. Additionally, familial income showed potential of increasing risks of lung cancer. In a larger context, it's important to note that over 70% of cancer deaths occur in lower to middle income countries with lacking pathology services, which provide further insight as to why recognizing the correlation between SES and cancer rates are important. Racial and sexual minorities are also more prone to receiving a cancer diagnosis, with African Americans being disproportionately affected by cancer and 1 out of 3 African American patients experiencing racial discrimination in medical facilities. Sexual minorities were also shown to have higher risk of lung, breast, anal, and skin cancer. Only 19% of the 47 cancer pharmaceuticals approved by the FDA in 2014 to 2016 met the overall clinical benefit standard established by the American Society of Clinical Oncology. Relative to their high price tag, the disappointing efficacy of these drugs leads many to express concern about its ethical marketing. The costs of developing and bringing a new pharmaceutical product to market are large, but the marginal costs of production are very small, begins Bennett et al. In the Journal of Health Affairs. With patent protection, pharmaceutical firms have strong incentives to increase demand. Speaking solely economically, cancer pharmaceuticals don't have the impetus to push lower prices. Recently, a Miami pharmaceutical has been under harsh criticism as they pulled out from a federal discount program for Medicare patients. Since acquiring rights in 2013, the pharmaceutical has increased prices exponentially for its brain cancer drug Gleostein. Increased prices of this drug had far-reaching effects, affecting the availability of further clinical trials, for example. The incident showed the ability of a private company to escape federal actions for financial benefit. In another case, the cancer drug Avastin was sold by GeneTech at an extraordinarily high $100,000 price tag per year. The company justified this high price tag with, quote unquote, the pricelessness of human life. Aggregating the cost of these drugs leaves systemic consequences, including the restriction of health insurance and a drop in employers. According to Ashley Love Sumrall, a neuro-oncologist in the Levine Cancer Institute, a patient who isn't fortunate enough to have a nurse navigator or a team is likely to find difficulty in navigating the financial aid. In context of SES, it is imperative to reject the view that we are morally obligated to spend any amount of money to preserve human life to the greatest extent of medical technology. Not only does this principle distort healthcare priorities, but it also ostracizes minorities and those of lower SES. So to combat these socioeconomic inequalities in a global health context, what can we do? Amidst these polarizing debates, experts have suggested feasible solutions. One popular method addressed in various studies details the quicker introduction of generic and biosimilar drugs. Generic drugs are drugs that have the same chemical composition as their patented counterparts, but are usually 80 to 85% less expensive. Biosimilar drugs likewise are products that are highly similar to an FDA-approved biological agent with no clinically meaningful differences in terms of safety, efficacy, or purity. According to a statement by the Congressional Budget Office issued in 2007, the use of generic drugs reduced Medicare Part D prescription drug costs by about $33 billion. Speeding up the introduction of generic and biosimilar drugs gives health opportunities to those who are financially incapable and helps alleviate disparities in socioeconomic status. Alternatively, price negotiations between governments and the industry could be changed based on global consensus. Hypothetically, the World Health Organization could establish a database of drug prices in commercially available locations. Essential drugs could be classified as essential within an affordable price threshold. For example, the UK National Institute for Health and Excellence has provided funding to utilize drugs within this financial threshold to acquire data on their cost effectiveness. This could allow for lower middle income countries to make higher end drugs available at a lower price and would promote health equity for minority populations. It is important to note that combating socioeconomic inequalities in current cancer care systems requires multilateral attention. From financial expenses to medical ethics, so many factors affect a cancer patient's experience in their healthcare system. In all, however, there's no doubt that efforts to alleviate this issue must be done unanimously in a coalition. With aggressive efforts to improve disparities, there is no doubt that humanity will triumph against its self-destructive disease. Here is my works cited. And thank you all so much for listening to my presentation. And thank you, Johns Hopkins, for giving me the opportunity to present. If you have any questions, please contact me through my email or through my Instagram at Siyeonish. Thank you.